That's John Hyatt. 7:41 the time, 19 minutes in front of 8 o'clock. This segment has incredible personal value here on this program and to me. Good morning. It's the Mornings with Ed show. It's the voice of Laguna. I just recently lost a very good friend, Roger Kempler, personal friend of the radio station, friend of everyone in this community. We lost Roger to pancreatic cancer just a couple of months ago. And 20 plus years ago, 25 years ago or so, I lost my mom to pancreatic cancer. After getting the initial diagnosis, 45 days later, she was gone. Roger fared a little better. Had a few months after he got the initial diagnosis. But most people, when you hear you've got pancreatic cancer, it's a death sentence. It is an absolute, there is no hope. Death sentence. That's the first thing you think of. Well, the Food and Drug Administration approved yesterday a drug for advanced pancreatic cancer. And it is everything that we're hoping that it is down the road. It's a great first step. It ushers in a new era of treatment for a disease that has been considered one of the most hopeless in medicine. It really is. When you hear the diagnosis of pancreatic cancer, there is hopelessness. So the drug itself is taken as 2 pills a day. It's the first of its type, and it's been and has really electrified cancer specialists and patients across the globe. It's not a cure, mind you, but it is the first treatment to substantially extend the lives of patients who have pancreatic cancer. The drug is called daraxonrasib. And it's made by Revolution Medicines, and it'll be sold under the brand name of Rasonque. It was approved for patients who have metastatic pancreatic cancer and have already tried chemotherapy. And in a key clinical trial, participants who got daraxonrasib, and I'm butchering the name, and I apologize, lived for a median of over 13 months. And that's compared with less than 7 months for those who just got chemotherapy. Some patients have gotten the drug through clinical trials. Those patients have lived for years. We've never seen a benefit like this. Revolution Medicine said the drug would have a sticker price, though, and here's the caveat, of $39,800 a month, or about $478,000 when patients take it for a full year. Now, the vast majority of the cost is expected to be covered through insurance, with varying out-of-pocket costs for patients. Now, since May, more than 2,000 patients have received free early access to the drug through an expanded access program that the company set up after its clinical trial concluded. The company said that people receiving the drug through this pathway would transition to getting it covered through insurance. And after designating the drug for fast-track review, the FDA approved daraxonrasib, there it is, just 35 days after accepting Revolution Medicine's application. So the pancreas, just for a moment, let's concentrate on the pancreas itself. It's a gland that's deep in the abdomen, and it helps regulate blood sugar and digestion. Pancreatic cancer kills more than 50,000 people a year here in the United States, and only 3% of patients whose pancreatic cancer is spread to distant parts of their body live for 5 years after being diagnosed. Less than 3%. The few available treatment options, which are typically grueling chemotherapy, that does very little to extend life. And for years, researchers had despaired of even finding a more effective treatment for this cancer. So at a cancer meeting in May, oncologists really, they stood up and applauded when this information was received. And according to people that were in that room, some wept when the clinical trial data was presented showing a doubling in survival times. The researcher who gave the presentation and led the key study is a doctor by the name of Dr. Brian Wolpin. Dr. Brian Wolpin is with the Dana-Farber Cancer Institute in Boston. He said that he was stunned by the trial results when he was finally allowed to see them. He says, I've never seen anything like that before in trials that we've run in pancreatic cancer. I just kept repeating, wow. So nearly all pancreatic cancers, as well as many lung and colon cancers, are fed by a mutated cellular protein that's called KRAS. Without it, they die. But there seemed to be no toehold for a drug to attack the smooth-surfaced KRAS protein and block it. And for that reason, the long-standing conventional wisdom in the field was that it would be impossible to develop a drug that hones in on KRAS. But over decades, a series of scientific advances upended that dogma, and the success of this drug showed that KRAS could be conquered, and it uses a novel approach that glues molecules together to grab and shut down KRAS. Again, not a cure, but a fantastic and unbelievable first step in fighting pancreatic cancer. And there is hope. It at least opens the door for hope, which is sometimes a marvelous first step. We're going to keep our eye on this story. We're going to be reporting on it often as we get new updates on it. And 7:47 the time.
The Mornings with Edcha will be right back.
This is a piece of string, a strand. Doesn't